Welcome to your sixth and final lesson in the course on the inflammatory process. I'm so excited to end us on a positive note, in which first we're going to talk about some of the healing that occurs after a muscle injury as an example of a specific injury. And then we're going to start heading into how can we help our clients best return to activity in a safe and quick fashion. So we're going to get right at it and first talk about an example of an injury of a muscle strain. Now, there's different types of classifications of muscle strains that we can have: grade 1, 2, and 3. Grade 1 is diagnosed as a mild strain. There's just a few muscle fibers that are torn, a little bit of swelling and discomfort, but you're not really experiencing a lot of changes in the strength or the function of the muscle itself. A grade 2 is more of a moderate strain in which you do get a loss of strength and function because of more damage that's occurring to the muscle. And then our grade 3 would be a severe strain in which we're dealing with a complete loss of function, usually because of a tear across the entirety of the muscle. And these are usually pretty rare. So the destruction phase that we've already talked about, we have the damage to the muscle or it's the musculotendinous unit we have where the tendon is joining in with the muscle. And we start to have dead tissue form in the area because of this injury. The second phase is when we start to enter into the repair phase. Now, we've already talked about this in lessons 1 through 5 when we talked about the phagocytosis that's occurring and the whole initiation of the inflammatory response. But we're going to spend a little bit time in this video now also talking about the repair side of it after we have dealt with the injured cells and we actually want to start rebuilding tissue. So first it starts out with satellite cells that are being activated to help begin repair of the muscle tissues. The satellite cells will proliferate and become a huge abundance in this injured area within the first 24 hours. And these satellite cells will differentiate into what are called myoblasts. So these are the fibers that are starting to lay down all of the tissue to repair the injured area. In the first 1 to 2 days, those myoblasts start to fuse together into what are called myotubes. So they become more elongated in nature. Around day 3 is when we introduce the revascularization to this area so we can actually add more nutrients to it and to help in this healing process. And then days 5 to 6 is when we're regenerating our myofibers to replace the damaged tissue. When this happens, we will then need to go into the remodeling phase in order for us to kind of solidify all of the changes that are happening and to remodel them into usable muscle again. So the regeneration of myofibers is occurring and they're becoming more mature. We've created a lot of scar tissue. So we will go through the process of trying to retract some of that scar tissue. And then our fibroblasts will work to transform some connective tissue in the area into myofibroblasts to actually ultimately produce more muscle fibers. So in panel A, what we're observing right here is an actual tear to the muscle itself. In panel B, what we start to observe is this proliferation of the satellite cells. You can start to see the satellite cells are coming to this area and are being activated, and they start to differentiate into our myoblasts. We can see that more in panel C, in which we have some of our satellite cells that have differentiated already into the myoblasts. And this is also the time period in which fibroblasts begin to produce some collagen, and they're starting to form scar tissue in the area. And this is all happening within this first 24 hours or so. So you can see that proliferation that was occurring, and then we have the differentiation from those satellite cells are now becoming our myoblasts. And you can see in between the two sections in panel C where the injury had occurred, you have that scar tissue that's starting to form. In panel D, what we'll notice is that those myoblasts are now fusing together to create our myotubes. We also have an increase in the scar tissue that is occurring in the place where that tear had occurred. In the next couple of days, we'll start to see the activity that is occurring in panel E. In panel E, the myotubes are now fusing with the surviving parts of the torn fibers. We also still see that scar tissue is starting to grow where that breakage occurred. Now we begin our remodeling phase, in which you can see in panel F, where we have everything is joined back together again. We have fully regenerated fibers, and we have a lot of scar tissue that is occurring where the tear had occurred. Now, this is the process that all muscle goes through when we are breaking it down and rebuilding it. And this includes even when we are doing this through exercise. So, an example, our most mildest form of muscle injury would be delayed onset muscle soreness. Now, everyone has probably experienced this in their life, in which we had a little bit too much training of an undertrained muscle, especially if we are doing eccentric movements. So the symptoms that people experience is it becomes stiff as far as the movement goes. They're sore, it's tender to the touch. It's hard to produce the same amount of force as it was previous to the damage that occurs. Usually we start to feel this all come on about 1 to 2 days after the workout session in question. The pain and stiffness usually peaks around days 2 or 3, with a full recovery within about 5 to 7 days. There isn't much remodeling that needs to occur because there was so little damage that actually occurred. Just as an interesting note, if we were to take blood samples, we would see elevated creatine kinase, which is a chemical that is released when is damaged, and it lets us know that there is injury in the body itself. But when it really comes down to it, there's no treatment that's really necessary for everything to rebuild. And remember, in fact, if we were to treat this with, say, ibuprofen or ice, we would actually see a decrease in the healing process, and that full recovery might end up taking a longer period of time compared to the 5 to 7 days that it should be occurring. So, what I want us to do now is to move into a little bit more of a practical application. How do we get our clients to be able to return back to the activities in the most safe and quickest way possible? So, early on in this healing phase of returning from injury back to activity again, we do recommend taking some time to let things rest. We do want to immobilize it, which means we're not moving it. We do find this beneficial, but we don't want it to last for too long. And really, the extent of how long it lasts is going to depend on how much tissue was damaged, the types of tissue that were damaged, and really, it comes down to the pain level. Pain is an excellent feedback mechanism to let us know when we are pushing things too quickly. We do want to avoid re-rupturing and also the formation of permanent scar tissue, because when we re-rupture, it can become a very severe injury and it takes a lot longer to be able to recover. So we're going to use pain as this level of letting us know how much activity is going to be tolerated. The more pain that is experienced, we should maybe back off of that activity a little bit more until it feels more comfortable. When we consider that we may have been treating for pain with ibuprofen or ice, which will dull the sensation of pain, in which we need to use that as our indication of whether we are returning back to activity too quickly or not. Working on mobilizing the injured area should be very gradual in this process, in both the range of motion and also in the intensity. So let's take the example of like a sprained ankle. If we had a sprained ankle, what we would want to do is to rest and immobilize it for a period of time. Based on pain, what we can start to do is introduce some range of motion activities using pain as our feedback mechanism on whether we should be continuing in increasing more range of motion or increasing in intensity. So what we can do is not have them bear any weight on the sprained ankle, but instead start moving it in different directions just to increase the mobilization of the injured part itself. As we are mobilizing it, we actually start to stimulate regeneration of the tissues. So it helps us in this process of healing. It increases the angiogenesis, which is when we are revascularizing the area. And it helps to actually align the fibers that are forming in the correct direction for the movements that we are wanting to do. So we do want to include all the different range of motions in which the joint can actually function. As we can tolerate the pain that is associated with that, we will increase in those range of motions and perhaps apply a little bit of intensity to it. As we move into days 5 to 7, we're now going to start on trying to build strength and stabilization in the area, not just working on mobility. So we've worked up our way. By the times we get to days 5 to 7, we should be using resistance bands for us to be able to start building up the intensity of the mobility exercises that we've been doing. Then we can start to work on eccentric strengthening of the damaged muscle tissues. So what that could look like is actually coming to full range of motion with the band and then very slowly starting to return it back into resting position and repeating that with multiple repetitions and sets. What we're working on is strengthening a lot of the stabilizers and support muscles, as well as trying to help us in regeneration of the tissues through movement. Research is not really showing that stretching helps a whole lot, so I would avoid stretching at this particular time period. But then the question comes, what happens if our symptoms are not improving after 7 days? We might have to consider that we are dealing with a more delayed regeneration process. So, some of the predictors that we have on whether we can return in a timely fashion back to our sport or back to activity include some of the things listed on this slide here. So, when we take a look at the extent of the bruising, that might indicate to us how long it might be before we can return back to activity again. With the larger the bruising, the longer the delay. Especially if we start to have blood collected underneath the surface of the skin, causing what's called a hematoma, in which it's not just a bruise, but you can actually see that darkening of blood collected underneath that surface of the skin. All of that might be associated with an increase in tenderness to the area, which will also let us know how quickly we can return back to activity again. And then really looking at that mobility. If we are not able to get our mobility back in our range of motion after about that 3 to 5 days after the injury, that's going to let us know that it will take a longer time for us to be able to return back to our activity again. Now, with a sprained ankle, typically we can start to put a little bit of weight on it after about 1 day of it being injured, and we can get back to normal walking within that time period. If we're seeing an extension of that time period, we're going to have to deal with a delay in returning back to our sport. If we had an MRI that was conducted in which we actually could physically see some structural damage and some of the signs of damage that we might see beyond just what we can see on the MRI itself, we might be experiencing decreased flexibility or pain with just the most basic of movements. And if this is not our first injury in the muscle or to this ligament, we will also see a delay in healing, primarily because of the scar tissue that was already formed. And it will take a longer time for us in the healing process to get back up to full functioning again. So, something to consider is whether we need to be having surgery when we are dealing with an injury. Ultimately, we would like to avoid surgery if at all possible. Muscle injuries do take a long time to heal, and they heal pretty conservatively. But some of our indications on that we might need surgery would be if we have a very large intramuscular hematoma, so a very large collection of blood that is building up within the muscle itself, not just on that skin surface. If it was a complete strain or what we consider a tear of the muscle in which it's completely separated, often that is an indication of us needing surgery. Or if it was a grade 2 strain with more than half of the muscle belly torn. Now, if we are needing surgery, it would be best for us to be able to perform the surgery within the first 3 weeks of when the injury occurred. We tend to have better outcomes with the healing if that's the case. If we do end up having surgery in the area, the process of getting back up to activity again will take a longer period of time because of the extent of damage that is created through the surgery process. So it'll take at least 4 weeks for us to be able to start getting back to a normal weight bearing and mobilization with our range of motion activities. And we should be able to get full weight bearing by the time 6 weeks has passed since the beginning of our injury. So, this gives us an idea of how we can get our clients returned back into activity again, the process that we'll be going through, whether things are able to heal on its own or if they are dealing with needing surgery to help treat the area. So this includes our course on the inflammatory process. It's the end of lesson 6. Make sure you've been following along and answering all of the questions that are provided for this lesson. Remember, you can go back and change any of the answers that you want before you submit. The last part is for you to go on and take the final quiz that shows your comprehension more long term of the topics that we've covered. Thank you for joining me in this adventure of exploring the inflammatory process and how we move from having injury to healing.